Good morning. I'm Dr. Richard Pan, and I'm really thrilled to be talking to you today. I'm sorry that I can't be with you in person this morning. Today is a very important day for healthcare. We are launching the enrollment for Covered California, and fortunately I have to be in Sacramento for the launch, and so I am unable to join you today, but I am excited that I'm able to talk to you through this video. And certainly the California Children's Hospitals are very important to me as a pediatrician. I know what an extremely important role you play in ensuring that children get the care they need, particularly subspecialty care, which is not available actually in many communities, even in a state like California. So the role that all of you play in ensuring that children across our state and even beyond in the rest of our country and around the world get high quality subspecialty care is critical to our communities. So I'm really excited to be here with all of you. And I know that the challenge of taking care of children with special needs is one that we are going to continue to have to work on in health reform. These children depend on specialists, surgeons, other types of services that are based in your institutions that are not available in many communities across the state. Because fortunately children are generally healthy, and children who have special needs tend to be a smaller portion of the population than, let's say, adults who have chronic illnesses. And the fact that children are only a subset of the population means that subspecialists are concentrated in particular facilities like yours. So it is important that these children still live in all parts of our state. So I know that one of the things as we look at health reform and our healthcare system is we want to be sure that every child who needs it can get access to the important services that you provide. In addition to providing valuable healthcare, tertiary healthcare, as well as secondary and primary healthcare, you play a very important role in advancing knowledge to help take care of these children. The research that takes place in your institutions is critical to the health of children, as well as to advancing our knowledge about disease. And also your very important critical role in education, in training the next generation of both clinicians and researchers in child health as well, is an invaluable resource to the state of California, our country, and the world. So this very important role that you play means that we need to ensure our healthcare system is there to help support those missions, that we need to be sure that the children are able to get access to the care that you provide. Now, there are certainly several challenges as we're moving forward in this regard. I know that the California Children's Services, or CCS, plays an extremely important role in ensuring that people have access to children's hospitals. I am proud to have authored a bill to extend the managed care carve-out for the CCS program. That will be expiring in a few years, and certainly I look forward to working with you to seeing what we should be doing moving forward to advance the CCS program and assure that access to children's hospitals. As a clinician who also represented a children's hospital in your association, I was a faculty member at UC Davis, and I was proud to serve as a physician representative to the Children's Hospital Association. I understand the issues that you've brought before the legislature in regards to the needs of children with special healthcare needs. And so we're going to need to work together to be sure that we look at the CCS program, be sure that the CCS program is there, that CCS program is going to assure the access to the specialists and the services that you have, and that we're going to be sure that in whatever structure that is moving forward, that we are going to be sure that children across the state are going to have essential access. But that does mean that we have to think creatively and we have to think out of the box and try to get ahead of the curve. So one of the issues that certainly that some people have expressed concern about is that what will happen to CCS. And I think in the discussions we had for the bill that I authored, I know that the Department of Healthcare Services has been working on looking at pilots to move CCS toward more of a managed care, integrated care system. We need to ensure that that in that discussion that we look and evaluate what is going to happen there. We certainly know that that the pilots have been delayed for most part, and so we need to ensure that that the state is thoroughly looking at and investigating different options, and also that you're engaged in the discussion. And I certainly hope that the children's hospitals, in concert with the Subspecialty Care Coalition, the American Academy of Pediatrics in California, and also groups representing families, are working together to look at what should be the future of the CCS program so that we can ensure that kids have access. In addition, as we are moving toward health reform with Covered California, with bringing in more uninsured, expansion of Medi-Cal to more adults, children are already covered by the Medi-Cal system. We need to be sure that as people are putting together networks, that those networks include children's hospitals and subspecialists, and that people will be able to find access to the care they need if their child should come down with a significant chronic illness that requires that kind of care. So we need to work together to figure out how those models work. Now, one of the things that I am doing to try to act proactively in that regard is putting together a task force to look at a vision for children's health care, and particularly around children with special needs, because we need to come up with ideas and models for what we want the healthcare system to look like for children. We need to be proactive in articulating that vision so we can develop the policies and then the laws and regulations that will lead us in a positive direction. So certainly we have a lot of work ahead of us. The Children's Hospital, the California Children's Hospital Association plays such an essential role in helping educate policymakers like legislators about the central role children's hospitals play. I want to continue to support the kind of work that you're doing, and certainly bringing my perspective as a pediatrician, the first pediatrician ever elected to the California legislature, to the discussion, and also as chair of the health committee, ensuring that the policies we develop are ones that aren't going to leave children out and are going to have children fall through the cracks. So I need you to partner with me and others in trying to get to that goal, and I look forward to your active participation in a task force and in discussions about the future of programs like CCS, looking at how our private insurance market is structured to ensure that children can get that access, and also to be sure that we set expectations about the needs of children. One of the other things I also just want to touch on is around thinking about how we can apply technologies to improve, again, access for children with special needs. As I mentioned earlier, we know that there are children with special needs throughout the state, while certainly only certain areas of our state have children's hospitals. And so how do we ensure we serve those areas of the state where it's not feasible to locate or build a children's hospital? And certainly to be sure we take advantage of the capacity we have here in this state. So I also look forward to your ideas and suggestions regarding how can we use technology to improve access to the services that you provide, and what are some of the things that we can try to do to assure that children are able to get subspecialty care and also high quality care that is coordinated with their primary care physician. So I've been a longtime advocate of the patient-centered medical home. We need to look at models like the patient-centered medical home to ensure that children are going to get high quality coordinated care that's focused on optimizing the management of their condition. So again, children's hospitals have such an important role to play in development of that kind of a model. So I think we have challenges, but we also have many opportunities with both federal health reform, with changes in the Medi-Cal program. So these are important times for us to be having this very active conversation, and I look forward to hearing from you, from your deliberations at today's meeting and in the future about where we should be going and the future role that children's hospitals can play ensuring that we improve the health of not only the children of California, but all of California. So again, thank you so very much for allowing me to address you today. Again, I really welcome this opportunity to have this conversation. I wish you a very productive meeting. Look forward to hearing about the results. And again, I'm sorry I can't be there in person, but certainly I am there with you in spirit, and I look forward to hearing from you. Thank you so very much.